Welcome to Retire Rich, Tales of Financial Freedom with Mark Hernandez and Carlos Lopez from M.A.H. Financial. In this podcast, we guide professionals of all generations, including Gen X, Millennials, and Baby Boomers, to answer an array of questions ranging from building wealth in 401k plans to selecting life insurance policies, including questions about IRAs, dividends, and bond alternatives. So tune in as South Texas's own financial advisors and fiduciaries, Mark and Carlos, draw from years of expertise, interview clients, and share stories of financial wisdom to accelerate your path to achieving your financial goals. Now, on to the show.
Hello, welcome to the podcast. I'm Dave. I'm sitting here with Mark Hernandez. Go ahead and say hello.
How you doing, Dave?
Happy Friday.
Happy Friday. I'm really excited to be here. We're going to talk about a subject that we haven't really talked about before, and that's Medicare and also long-term care.
Now, okay, you're talking about healthcare costs in retirement. Okay, now what do I need to worry about?
Well, the first thing is, we work our whole lives building doing retirement planning, building assets, so we can have a real comfortable retirement. But the thing is that people don't realize that once you retire, that there could be additional costs in health care and to care for yourself that could wipe all of those savings out. A person retiring at 65 could expect in their lifetime to spend over $165,000 on average on the cost of health insurance. Out of pocket costs, the cost of Medicare or additional supplements over their lifetime. So the thing is that you need to adequately prepare for this situation.
So that's what Medicare is.
Well, Medicare is a federal health program, insurance program for individuals 65 and over, or it could be for individuals that are younger if they're disabled. And we're going to talk about is there's different parts of Medicare. Okay, there's Part A, which is hospital insurance. It covers inpatient hospital stays, skilled nursing care, hospice, and some home health services. So most beneficiaries don't pay a premium for Part A if they or their spouse have paid Medicare taxes for at least 10 years. Then you've got Part B. And Part B is things like doctor visits, covers doctor visits, preventative services, medical equipment. And for that, beneficiaries pay a monthly premium, which is based on income. So you're going to find when you retire that a lot of the benefits that you're going to get are going to be based on income. I have some clients that, they retired, they might be getting a pension and some Social Security. And normally, they might be paying anywhere from $150 to $200 a month for the premiums on their Medicare and their supplements. But then I have clients that might, doctors, or they own their own businesses, they're highly successful, and they may be paying over $600 to $700 for those same benefits. So the cost of Medicare will be based on your income. Then let's talk about Medicare Part C or Medicare Advantage. That's offered by private insurers. These plans combine Part A and Part B, and often Part D, which is prescriptions. They can provide extra benefits like dental or vision and hearing coverage, and the cost of the coverage varies by the plan. So that's Part C, and normally it's termed a Medicare Advantage plan. And then you've got Part D, which is your prescription drug coverage. So that would cover your prescriptions, and it's also available through private insurers.
Okay.
And premiums could be also vary on that.
You'd mentioned that there was a Advantage plan. What's the difference between that one and the original one?
Well, the Advantage plan is offered by private insurers. Okay, so you're going to be able to go out and select who you want to do business with there, and they can offer a variety of services and plans. Where Part A and Part B are the ones that are offered by Medicare, and you don't have a choice on who you can choose for that.
Okay, it's about choices. Okay. So what is the Medigap insurance I hear about?
Okay, well, Medigap insurance are private policies that help cover your out-of-pocket costs, okay, or anything that might not be covered by Medicare. And that's going to be an extra cost to you. So again, this is something you need to plan for. And but by using proper planning and making sure you have the right coverages, that could eliminate having unexpected issues come out in the future. You know, where you have maybe you go in the hospital, you have a major surgery. Then by having these different types of programs, you're going to be able to have most of the costs covered by these different plans.
So if I've got Medicare, what does Medicare cover for LTC?
Okay, for now we're talking about getting into long-term care.
Yes.
Well, Medicare normally will cover the first 90 days that you might need to be put in a assisted living facility or a nursing home care or even home health care. But the thing is that after that, Medicare is very limited. It's not going to pay for your long-term care. So unless you are covered on Medicaid or you're very low-income individual. But for most people, majority of people, they're going to have to cover those costs themselves, and it can be very costly. So a long-term care facility could probably cost you anywhere from $3,000 on the low end to up to $10,000 and more. So the thing is that I like to say that long-term care is, especially if you get a long-term care insurance program, that's dignity insurance. And the thing is that long-term care is very costly now, and in the future, as the baby boomers age, and it's going to get even more, I'm sure it's going to get more costly.
So that's the insurance is going to help pay for individuals for their long-term care costs. Now, what about HSAs?
Well, first off, let me go back to the long-term care. So the long-term care comes into play, and when you're going to be able to use it is when you have trouble bathing, feeding yourself, transferring, dressing, those type of things. And those are called activities of daily living. So normally, if you cannot do 2 of 6 activities of daily living, and a doctor notates that, then you're going to be eligible to start utilizing a long-term care plan. And long-term care plans, again, you can cover the cost at your own expense. That's very expensive. I mean, as I mentioned before, $4,000 to $10,000 plus a month. Now, you can get a long-term care plan and pay for it like you would an insurance policy, and you can get programs that would cover you, and you can be choose various options. So you can go get a long-term care plan where you can designate when the plan would come into effect. So you could get a plan that would start after you need, a doctor says you cannot do 2 of 6 activities of daily living, then you can get a plan that could start in 30 days. You can get a 30-day waiting period, and then you can choose the duration of how long you're going to be covered on that plan. And the duration could be 1 year, 2 years, 3 years, 5 years, and in some cases could be unlimited. Now, those type of plans are very expensive. Okay, so the thing is that you can pick and choose your waiting period, the length of the time, and then you can get optional programs on there, such as an inflation rider, a return of premium rider. Inflation rider means that once you start receiving benefits, that the benefits can go up based on what inflation is doing. You can get return of premium rider that say you don't use the plan, then that premium could be returned to you. But again, those other options can cost money. Now, the way to save money on long-term care plan also is a spouse and the 2 spouses applying together. Then you usually get a discount usually up to 10%. But if you just have one spouse applying, or there's only one in the family, it could be a widow or widower, or unmarried, then at that point, there's no discount. Now, when you brought up HSA, health savings account. Well, a health savings account is a tax advantage plan where you can save money and you can use that money for qualified expenses, such as out-of-pocket expenses, such as doctor visits. So you can use that and utilize tax free money to pay for those qualified expenses. And I highly recommend if you're planning, if you're not retired yet, that you open up an HSA account and just keep the money in there for future programs. Because you can get an HSA account and utilize it for dental, for vision care, for hearing care, and again, out-of-pocket expenses for deductibles, those type of things. So again, with proper planning, utilizing an HSA program, utilizing a long-term care program, and also getting a Medicare supplements or getting on the Medicare Advantage plan, and working with private insurers to ensure that you have the highest quality of coverage, so that way in the future, when you retire, that you're not going to have to utilize the hard-earned savings that you've saved to pay for everything, because that could wipe you out in a quicker time period.
So if I was 65 and I was retiring today, what do I need to cover all of these expenses?
Well, the first thing is that 90 days prior to becoming 65, you should already be applying for Medicare. Okay, you should be applying for Part A and you should be applying for Part B. And again, you can start also looking at outside insurers, so that way you can look at other type of programs. There's a Plan G plan, which incorporates Plan A, Plan B, and Plan C, but that also can give you more benefits. So there's many different ways of applying for Medicare, and the thing is to work with a professional, an advisor who is an expert on Medicare. Okay, there are advisors that we're as an advisor we're trained to manage your money. We're trained in various aspects and various programs, but you may have an advisor that is not skilled or knowledgeable on Medicare and all the different programs that can come with Medicare, like a Medicare Advantage plan and the different plans. So I highly recommend prior to attaining age 65 to start looking into these programs and get set up to what fits your budget and what fits your needs.
So what is your one key takeaway you want people to really understand about navigating this healthcare?
The one thing I'm going to tell you to do is, again, like I mentioned before, proper planning. Don't wait till the last minute to do it. Start investigating the different type of programs. Work with an advisor who is an expert on Medicare and Medicare supplements, and then work with, hopefully that advisor is also an expert on long-term care and long-term care planning, because I think that goes hand in hand. And I will tell you out there, if you're listening to this podcast and you're not 65 yet, don't wait till you're 65 to start looking at long-term care. When I was 45, that's usually the age you can start getting long-term care. I got a long-term care plan in effect for my wife and myself, because I felt that it's not just getting old that I can't take care of myself, but what if I was in a car accident and I became disabled? What if I had a stroke and I became disabled? And I think of Christopher Reeve, when he fell off the horse and became
Superman.
paralyzed. Yeah, if that happened to you, Christopher Reeve at that age needed 24-hour care. So at that point, I bought a long-term care plan, And I'll tell you, the younger you are, the cheaper it is. So again, if you're out there and you're not eligible for Medicare, that doesn't mean that you can not look at a long-term care plan as part of your planning. And I'm sure glad that I did look into it, because as I said, the cost is still the same. The benefits would be tremendous if something happened to me. So I highly recommend that you look into that as early as possible, which would be age 45 and above. And then start, when you get close to 65, start looking at how Medicare works. Start looking at what plan would be beneficial for your lifestyle and your income level.
I believe you call that dignity insurance, right?
No, I call long-term care dignity insurance, because I will tell you this: the generations before, if the parents aged, well, the kids, they depended on the kids to take care of them. Well, that doesn't work these days. Okay, nowadays, what I've seen, my experience, and what I'm seeing is that if a person is needing home health care or assisted living facility or nursing care, that their kids are basically too busy. They're not in a position to take care of them. And again, who wants to have to bathe your parent or change their depends, or have to clean them up after an accident? Who wants to do that? So by having a long-term care plan, you can call that dignity insurance, because you insure your car, you insure your home, you need to insure your dignity. And that's what a long-term care plan can do for you: insure your dignity. And by proper planning, Medicare and getting the different options, whether it be a Medicare Advantage plan or a different type of plan with a private insurer, will ensure that you don't have to utilize your hard-earned savings to pay for expenses that might come up during your retirement year for medical.
Well, I hope everybody listening out there pays attention and does themselves a favor and get that dignity insurance.
I would generally hope so. And I want to thank you for the opportunity to visit with you today, and I hope that what we've talked about will make a difference in your planning.
All right. Thank you, everybody.
Thank you for listening to Retire Rich, Tales of Financial Freedom. Have questions about topics covered during the show? Visit our website at www.mahfinancial.biz or give us a call at 956-994-0407. Don't forget to click the follow button to be notified when new episodes become available. Investment advisory services and financial planning services are offered through Simplicity Wealth, LLC, an SEC-registered investment advisor. SEC registration does not constitute an endorsement of the firm, nor does it indicate that the advisor has attained a particular level of skill or ability. Insurance, consulting, and education services offered through M.A.H. Financial. M.A.H. Financial is an unaffiliated entity from Simplicity Wealth. Clicking the like button does not constitute a testimonial for or an endorsement of our investment advisory firm, any associated person, or our services. Clicking the like button is merely a mechanism to circulate our page. Like is not meant in the traditional sense. In addition, postings to our page must refrain from recommending us or providing testimonials for our investment advisory firm. Because the SEC and state securities regulators generally prohibit testimonials, any such postings are subject to swift removal.